we used to get a lot more questions about is a nurse visit. We don't get as many about those these days. Hi, Shannon DeConda here with NamUs. Do you often bill the code 99211? I have to admit, this is a service code that isn't used much anymore these days, but it can be an excellent code to bill for the overhead that we get in our office by merely using our office staff, and we should use it. Matter of fact, when we sign that PAR agreement with our insurance companies that we choose to be PAR with, the agreement states when a patient comes into our office for a billable and reimbursable event that we will bill the insurance company for it. So for those reasons, we should be billing for those nurse visits. So why have we seen a fall off in the utilization of nurse visit codes? Well, I think we've seen a fall off there because of a lot of reasons, maybe high deductible health plans. A lot of patients give pushback. I don't feel like I should have to pay a copay or I should have to pay a high deductible premium to just visit the clinical staff. But the problem is, and I've said this frequently throughout my career, if you can be sued for it, then you certainly have the opportunity to bill for that service. And certainly if a patient comes into the office today and they are seen for maybe a blood pressure check, and then something catastrophically goes wrong after that blood pressure check, based on maybe a poor reading by your staff, then certainly you should be able to be reimbursed for that service. So for that reason, among others, then we absolutely should be looking at those services as ones that we bill and we are reimbursed for. Additionally, our providers in a lot of practices have said stop billing for it because they're tired of dealing with the patients and the pushback from the patients. But again, our PAR agreement state if a patient comes into our practice and they're being seen for a service that should be billed for the insurance company, we should bill that service. Therefore, you should bill that service. So I'm bringing this up because someone from our NamUs membership posted a question this week. Hi, Catherine. Thanks for your question. Great question. Is it appropriate to bill for a nurse visit, 99211, when a patient comes to the office to review the instructions for a home sleep test? So if I'm going to come online and tell you, hey, we should bill for nurse visits when we can, and your insurance companies say that you should, I should follow that up with when is it appropriate to bill for these visits? Well, the best rule of thumb is like anything else in our industry, and it's medically reasonable and appropriate. That's easy. Is it medically reasonable and appropriate to have that interaction with the patient? And if the answer is yes, then it could be reimbursable if and when documented appropriately. So we'll get to Catherine's question in just a moment, but let's do another one that's kind of gray. I have a patient that comes in and they're here to get medication samples, just to pick up samples. So I come to the front desk, I pick up my samples and I leave? Absolutely not. But maybe I'm coming in to pick up medication samples for birth control because I can't get in with the OBGYN for another month or two. And so the medical assistant brings me in and they say, hey, Shannon, are you smoking? Have you had regular menstrual periods? What's been going on? And they're actually doing that small nursing interaction with me to make sure it's okay to give me that sample. That could be a medically appropriate encounter. So let's take it another step further. A lot of times we have patients that come back to the office for a second urine check. Second urine checks, absolutely. The patient's coming in, we're dipping the urine to see if they still have a UTI. And the medical assistant, the lab tech, the nurse, whomever is looking at it and saying, your urine's clear. How are you symptomatically? Now, if we're just dipping the urine and we're not following that up with an engaging follow-up visit with that patient, then we're just doing a urinalysis. The key here is it's just like a physician visit. Are we doing a follow-up nurse assessment with that patient, or are we just doing a urinalysis? In Catherine's question, she specifically says, we're giving that patient instructions for a home sleep test. Now, if I had Catherine here sitting beside me today instead of a ghost, I would ask Catherine, well, are you going to bill for that home sleep study? Because that is work that you're doing. You're doing a work towards that pre-op, if you want to call it that, work towards prepping that patient and getting them ready for that home-based study. So in reality, no, that's really not a nurse visit and something that shouldn't be billed, because you're giving them the equipment to do a study that should then therefore be billed in the practice. So be careful what lines you're crossing. And remember, if you have any questions like that, that's why we have the Ask the Expert benefit through the NAMUS membership. So one more thing on nurse visits, the other question that comes up a lot is, who can perform a nurse visit? It does not have to be an RN or an LPN or a medical assistant. It can be anyone who the physician whom they will be billing under feels appropriate, or they can also bill under a nurse practitioner or PA. Whoever they're billing under, they feel that they have the expertise to do that visit. So those credentials are all that's required, which may be no credentials at all. And the documentation that's required, enough to substantiate that a medically necessary interaction was provided to that patient during the encounter. So I hope this answers all of your questions, but if you have any others, don't forget, you can contact me anytime. My email address is below, and I look forward to chatting with you next time. Have a great day.